Let's see about trismus. Trismus is also known as lockjaw. So, it is a painful condition in which the chewing muscles of the jaw become contracted and sometimes it is inflamed. So, preventing the mouth from fully opening. So, the fully opening the mouth means opening it beyond 35 millimeter. So, a little greater wider than the width of 2 fingers. So, more than 2 fingers. It is normal opening is more than 2 fingers or 35 millimeters. So, this picture showing the patient having trismus because here the mouth opening is only roughly around 17 to 18 mm. So, when the mouth opening movement is restricted, a number of problems can arise. So, these include feeding and swallowing problems, oral hygiene issues, and even difficulty speaking. So, feeding, definitely there is a problem in feeding and swallowing, and can't do proper brushing. So, the oral hygiene is also affected. So, it is commonly seen in certain groups, particularly in those who have had oral surgery to remove their wisdom teeth, have had head and neck cancer in a region involving structure that influence mouth involvement, and have undergone surgery or radiation treatment to head and neck. So, wisdom tooth removal, and there is a head and neck tumor cancer or cancer removal, and undergone head and neck radiation treatment. So, trismus is not the same condition as tetanus. Tetanus is an infection caused by the bacterium Clostridium tetani because there is a vaccine for preventing tetanus. So, it is a rare infection. However, when tetanus does occur, may have muscle stiffness and spasm that are very painful and could occur anywhere in the body. In trismus, it is only occurring in the jaw. A notable area where this occurs is in the head and neck region where it causes trismus. So, tetanus is one of the reasons for causing the trismus. So, trismus may also caused by tetanus condition. So, in most cases, trismus is temporary and resolved within around 2 weeks. No need treatment. And however, in some cases, it can take longer to resolve and may even become permanent if left untreated. So, trismus may also last longer and could be more resistant to conventional treatment in those who develop fibrous tissue due to radiation therapy. So, most cases of trismus are resolved within 2 weeks. So, what are the causes for trismus? The first one is trauma. For example of this include when bone of the jaw are fractured, when they are immobilized to let a fracture heal. So, when it is trauma, mostly it causes trismus. And the second cause is oral surgery. While trismus can arise after any oral surgery, it's sometimes seen after the extraction of wisdom tooth and especially of the lower wisdom teeth. And trismus can occur due to the inflammation of the surgery creates or the hyperextension of the jaw during the procedure. So, there is a hyperextension or inflammation at the site. So, it can also happen when a needle delivering the anesthetic inadvertently damage surrounding the tissue. It also causes the trismus. And the third cause is temporomandibular joint disorder. On each side of the jaw, there is a TMJ, that is temporomandibular joint. So, this joint acts as a sliding hinge. So, connecting the jaw to your skull and allowing to open and shut the mouth. So, when there is dysfunction in the joint, it can cause trismus and pain. So, joint dysfunction can happen due to trauma, arthritis, genetics, misaligned bite, stress-related behaviors like habitual clenching and grinding of the teeth, that is bruxism. Habitual clenching and grinding of the teeth is bruxism. And the fourth cause is radiation for head and throat cancer. So tumors that interfere with the function of the jaw itself can lead to trismus. So but it more commonly occurs due to radiation of cancer involving the jaw. So this can cause damage and lead to the creation of scar tissue around the joint area. So it can cause damage and creation of scar around the joint area. So it would cause trismus. So what are the symptoms for this condition? So mouth that will not fully open. It is very important. So it is causing opening difficulty. It is the hallmark of trismus. So what are the other symptoms? Pain in the jaw. Even without movement there is a pain. And difficulty or discomfort performing activities that involve opening the jaw, mouth wide. Not able to brush properly. So example. So inability to chew or swallow certain food. And muscle pain. So what are the treatment for this condition? The first one is use of a jaw stretching device. So these devices fit between the upper and lower jaw. A physical therapist will tell which stretches to perform and how often. First one is jaw stretching. Use the jaw stretching device. And the second one is medication. Doctor may recommend or prescribe a muscle relaxant, pain reliever, or anti-inflammatory medication. So some research suggests that combining corticosteroids and non-steroidal anti-inflammatory drugs may be effective at decreasing the post-operative trismus. So mainly muscle relaxant and pain reliever are given to the patient for treating trismus. So the third one is physical therapy. This typically involves massaging and stretching the jaw to help loosen the muscles and decrease the pain. So it is very important, physical therapy, because it loosens the muscle and decrease the pain. So that's why it releases the pain. And the fourth one is dietary changes. So following a soft food diet and avoiding hard, crunchy food is often recommended to ease pain until symptoms is improved. So we have to recommend the soft food diet, avoiding the hard food. And the fifth treatment is acupuncture. So while more studies are still needed, some research suggests that acupuncture could be beneficial for muscle relaxation and pain management in disorders affecting the jaw muscle. So acupuncture may also use in the treatment for trismus. So the sixth treatment is craniosacral therapy. So this gentle hands-on form of alternative therapy has been shown to help reduce chronic pain, and craniosacral therapy is often performed by chiropractors, massage therapist, and osteopath. So craniosacral therapy is also used for trismus patient for reducing the pain and improve the mouth opening. So what are the trismus exercises? So there are several exercises that can help provide relief from trismus by stretching the jaw to decrease inflammation and pain. So these exercises can be repeated several times throughout the day. So be sure to massage your jaw muscles in a circular motion for 30 to 40 seconds before trying these exercises to help and loosen your jaw muscle. So first you have to massage the jaw muscles in a circular motion for 30 to 40 seconds before you are going to other exercises. So first step is doing the circular motion for 30 to 40 seconds. The first exercise is open your mouth as wide as possible and hold for 10 seconds and then close. So and repeat for 5 minutes. So close and open and close. So open your mouth as wide as possible. This is second one. So move your jaw to the right and then close. Repeat in 5 minutes and then do the same on left side. So right and left movement is second. open and close and right and left. And third one is stretch neck by moving head forward and backward, then turning left and right. So bend your head and press your ear to your shoulder, so holding for 20 to 30 seconds before repeating on the other side. So this step is for 5 minutes. So first one is open and close and right to left and forward and backward, turning left and right, and your ear to the shoulder. So these are the exercises. What are the home remedies are helpful in Trismus? The first one is massage. Definitely we do massage. And the second one is stretch the neck. And third one is avoid clenching your jaw shut or grinding your teeth together. So avoid bruxism habit mainly. And the fourth one is take a magnesium supplement. So magnesium is an important mineral involved in the pain regulation. That's why magnesium supplement is used. And the fifth one is limit caffeine. So limit caffeine intake. So caffeine may worsen the trismus by tightening the jaw muscle. So limit the caffeine intake. And the sixth one is heat therapy. So placing a hot moist towel on the jaw for 15 minutes and it will relax the muscle and promote blood flow.